On behalf of the platform Learning General Surgery, I welcome you all. I welcome especially our guest, Dr. Nilakantan Ananthakrishnan, whom we all know, and actually has been with the Learning General Surgery from its inception and has been quite active teaching the students here. And to have a sort of intimate chat, we have Dr. Vidya Mohanram, who's an anesthetist, actually belongs to the opposite group actually, and then she's got her own thing at how to go about. And welcome all the classmates, friends, and associates. And Vidya, it's your time.
Good evening, everyone, and I don't know whether to thank Patta or to curse him for getting me into a situation like this. But it's going to be a real privilege for me to be able to have a heart-to-heart chat with my professor, teacher, and maybe not role model because I didn't take up surgery, but nevertheless role model as a doctor and as a professional. Though I might have probably done only 10% of what he's doing. So thank you so much for being my first ever interviewee, sir. I've never interviewed anyone in my life. So if things don't go right, please help me out.
Okay.
So actually what RK is looking for is some kind of...
But the induction has to be smooth.
Absolutely. Absolutely. So I had the privilege of being an undergraduate student and also training in anesthesia while Dr. Ananthakrishnan was faculty in JIPMER Pondicherry. And actually he and some of his colleagues like Dr. Smiles really spoilt me because, I can't take bad surgery after seeing such, excellent people operate. So, sir, I really loved your message on Doctor's Day, where you said that, all along you have just worked not for getting validation for somebody else or being appreciated, whether somebody acknowledges what you do or not. So, actually, that is the truth about all anesthetists, isn't it? So, how often in your career do you take time and opportunity to actually appreciate something that your anesthetist does or encourage your anesthetist? How often do you do that, sir?
See, Vidya, it's like this. If I ask you that question, have you ever said well done to any surgeon after the procedure? Probably you will have to think hard to find an instance when you did. So, do you remember?
Yes, sir. I actually, because Dr. Kangle and Dr. Ravishankar, who are our teachers, they actually imbibe the culture of actually watching every step of the surgery and being, sort of with the surgeon through the entire procedure. So, maybe I'm an exception. I don't know, but I am always, with my surgeon and. Saying, hey, wow, that was great, or, whatever, I think we did a good job today and stuff like that. Yes.
No, I think the fact that it is a teamwork is very, very clear these days because a lot of we owe to the people on the other side of the screen. And that's exactly what I told Ravi about 3-4 years ago. We were standing in the Ether Dome together and looking down at the table where the first anesthetic agent was administered in Boston, and we still have a photograph of that occasion in MGH Hospital. And I was telling him and reminiscing that we wouldn't have ever been able to do many of the things if it were not for them. And in fact, we should acknowledge it much more than we do normally. But I think when you get used to somebody over a period of time and they get used to you, they know how you feel and you know how they feel, and words are not really necessary. And the fact that things go smoothly is a tribute to them. because we are up to our neck in blood, and they are the ones who keep the patient alive. So I think we owe everything to them.
Thank you, sir. So that validates the fact, like what Patta said, that it's actually a spousal relationship. It's not like every day you're saying "I love you" to your spouse, but you know that they know that you appreciate them, and vice versa. But
Yeah.
then again, just like how on birthdays and anniversaries, everyone likes to be kind of remembered and pampered. So maybe once in a while, especially the younger people who join, the older anesthetists with whom your Dr. Ravi Shankar will not be looking for validation from you, but maybe the postgraduate or the senior resident who's joining, maybe a small
Yeah.
word of praise from you will go a long way in
I think that's the point well taken. Maybe we should do it much more often. But many of these things we take for granted in the pressure of work, and that's probably not good. I agree with you.
Continuing on this thing about teamwork, sir, I know that you have published several papers. So, how many of them were your anesthetist part of your publication or part of your team that worked on that research project or a study or anything?
You see, Ravi and I did the first paper, I think, from India on an audit of operation room time utilization. And it was published in a fairly high quality index journal, and it has been cited as one of the first papers about that. And after that, we have done 2 or 3 other papers together. I have written with Dr. L.J. Chandrasekhar also, and one paper with Dr. Prabha Kangle, whom you might remember. So
my mentor, sir, my mentor.
Yeah. And the first anesthetist that I encountered, some of you might have heard of some of those when I was doing at All India Institute. A lady called Dr. Govind, you would have heard. Govind was head of the department, and Dr. Sushila Dhawan and Dr. Nalini Kalle were the anesthesiologists in charge of our operating room. And very strict ladies, but very sincere and very, very good. And then, of course, we had Dr. Kangle in Jipmar, and I'll never forget her contribution to the operating room during the days that a lot of time that I was in Jipmar till she retired. So,
do you think any of us have reached anywhere near where she was, given the fact that it was like many years ahead? I mean, many years before.
I don't know, because honestly speaking, since you are getting every word of mine validated, I haven't watched you after you are qualified, is it not? So it's difficult. I have some lady anesthesiologists working with me now, Dr. Rani and all that. They're very, very good. They're really good, and I don't see any gender difference in their efficiency. So I'm sure in Malar Hospital, if you ask, they'll be able to tell you much better than I can.
No, sir, I didn't mean myself. I just meant that somehow I felt that she was a tough act to follow. And, actually, she taught us how to be a team leader in the operation theatre, whereas many parts of the country, even today, the anesthetist, assumes sort of a subservient role, or, thinks that they have to be a yes man to the surgeon and things like that. But
okay. I have to come in here, Vidya, because this is the first time I'm going to disagree with you.
Okay.
The anesthetics in academic environment are quite different from the anesthesiologists in the corporate sector. In the academic environment, they rule the roost. You could have had a PAC checkup 5 days ago and got everything done. But if you annoy them the day before, they'll light a list of investigations for which you have to get an appointment. and it'll postpone the whole thing by 5 or 6 days. And therefore, but in the corporate sector, whenever I watch the anesthesiologists in the corporate sector, they are quite different. I don't see this type of thing. Is not subservience, but much more of fellowship and joint work. That it's not sort of you versus us and all that. Somehow that in academics, it seems to be a little more prominent, although there are excellent people who don't do that. But often there is a conflict where there is no need for a conflict because all of us are working for the common good. And but it's different in the corporate sector and the academic
Learning
sector.
General Surgery group has got a full spectrum, sir, from students to professors in medical colleges to so I would like to take this opportunity to emphasize that we should learn to work as a team, and probably what is ideal would be somewhere between what's happening in the medical colleges and what's probably happening as a freelancer. The corporate sector in most places would probably be a good example of how there is a equal partnership between the surgeon and anesthetist. So let's hope that we all have a nice relationship like how Patta and his team have, and I like to think my team and I have. You'll have to ask my surgeons for that for validation. But yeah, so that is. So I just want to go back a little bit behind, sir. From your interview with Patta, I learned that your dad was in the armed forces, and you were kind of shunting schools or different places and all. And I had a kind of similar background. My father wasn't a uniformed person, but he was in the ordnance factory. So similar story.
Okay.
So do you think that it helps us to have a sort of a better perspective, and strangely both of us returned back to our so-called roots, in the sense after being around in younger age all over the place, we landed up being in Pondicherry and Chennai, and but do you think it gives us an advantage in being more accepting of others and being more easy to get along with? Do you believe that?
It has both advantage and disadvantage. The advantage obviously is you have a wider perspective. You've seen a lot of schools, a lot of teachers, a lot of classmates, and different environments, different languages. That's why because of my father's connection with the army, I became very facile with some of the languages of the North, and which helped me much later when I did my post-graduation at All India Institute, because most of the patients there talk in Punjabi anyway. And unless you understand that, it's very difficult to deal with them. But the flip side is, you don't get to make lasting friendships. If my brother studied in the same school for 9 years and my youngest brother studied in the same school for 11 years, and the type of friendships that they have, you don't get, because you are here 2 years and then suddenly in the middle of the academic term you go somewhere else. So you don't have a sort of a route, but it certainly gives you a broader perspective. And the perspective is, because of the army, we were in a place called Sagar in Madhya Pradesh, and it's now got a university. It's a big place. Those days it was very small. There's only one school, and St. Joseph's Convent, and I was the only boy in class. And for 2 years.
You have been in the situation like how in my time the lady surgeons felt in a surgical department. So Kadam, are you there? Kadambari?
Oh, Kadambari is here.
Okay, I'm not sure. Maybe we get back to her. So, what was your? Most of the places, the number of the anesthetists land up being more female anesthetists than male, isn't it, sir?
Yeah, I think that's probably true.
So
Although I
did you
don't
do you
have real figures,
in
probably
your
true.
in your experience, do you find handling or working with lady anesthetists easier or men?
No, I really not found any difference. Absolutely no difference.
I'm so glad to hear you say that, sir. You have inspired a whole generation of surgeons, my classmates, and also I'd like to bring in my classmate Shaitan Singh Rathod, uh, who is now
Oh, Shaitan
principal and
Singh.
controller of SP Medical College. Shaitan, I would like to say something, sir. Unmute yourself and speak. Shaitan, unmute yourself. Shaitan, unmute
Yes, sorry.
yourself.
Thank you. Well,
Unmute yourself.
thank you for
Yeah.
calling me on this Zoom talk, and it was really a pleasure meeting you all on online, especially our sir, teacher, Revered Dr. Ananthakrishnan ji. I still remember him, and at present I am at Bikaner Medical College. Earlier I was at Jodhpur Medical College, and you were talking about gender difference in anesthesia. I agree fully with Dr. Ananthakrishnan. I too have no issues or hang-ups about gender differences. All the male or female anesthesiologists have been very cooperative and very friendly to at least me. I don't know why. And if you ask my anesthetists all over the place where I have worked, they always, I don't know what is the reason, they appreciate me and they say the surgeon should be like me. Because when I came to Bikaner, one of the anesthetists, lady anesthetists, told me, I've just joined 4 months back only at Bikaner. She said, sir, the anesthetists at Jodhpur were very praising high of you. So it all depends on personality to personality, I believe. There is no rigid rule or thumb rule that certain gender will be good or certain gender will be bad. It is, if you are good, everyone is good.
Well said, Shaitan.
So again, so it actually comes. So I'd
Thank you, Patta.
not all those who were inspired by you landed up training under you, sir. But I'd like to bring my friend Muthu on, who did not train in JIPMA, but probably got inspired to take up surgery after seeing you operate. So Muthu, you got to say something.
Yeah, I wonder if he remembers me. Do you, sir? I don't know. Anyway, I'm a whole lot different now.
Tell me the bad news first.
Nidhi Sibbal's classmate, if that helps to remember.
Yes.
Yes.
No, the thing I remember most about you was when I was training in as one of my, I forgot what posting you call that, an extra posting. I was doing anesthesia. The reason I took up anesthesia was because I used to see so much of argument between the anesthetists and the surgeons when I was doing the surgical posting. So I wanted to find out what is so wrong in anesthesia that we are forever fighting. And when I was on the other side, that's when I actually worked with you, because you literally grabbed the line of my hand and said, I'm going to insert the line because I haven't done one in ages. And you put in the line and I felt so cheated.
Did I get through on first attempt?
Second attempt.
Oh God.
Because I wanted to take the line from you and said, I will put the line in. And you said, no, I will do it. And you did it the second time. But it was a very enjoyable posting.
Good.
And about you, many of the content, you said that you are known as AK-47, and people are scared of you and find you unfriendly and all that. But actually, I think differently. I somehow remember you as being, okay, you have a sharp your wit, and you may be a little bit sarcastic, like how Dr. Geeta Rajagopal used to be. But then I think you were quite open. If somebody wanted to have a chat with you, they could. And I remember you're making fun of me while you were operating. You said, you know what? 2 RBCs have come out of the artery, and Vidya will immediately start measuring the blood pressure. Because those days we didn't have automatic BP machine, so we used to pump the sphygmomanometer to get the pressure up. So when I was actually doing it every few minutes, so you just looked around and said, "Oh, there you go, 2 RBCs have come out," and Vidya will start looking for hypertension. So I know for a fact that you are aware of what is going on. You are there are some surgeons who are completely oblivious to what is happening on the other end. It can be because they have complete faith and they think that they don't need to. Similarly, there are anesthetists also sometimes who don't seem to have anything to do with the surgery. But I think the ideal is when you also have a eye on what's going on this side, and we also do. So, sir, coming up, you spent a lot of time in the department, and you are very you used to spend a lot of time teaching.
No, let's finish with this AK-47 thing. This started.
So, my vote is
this started in the year 1977 when I joined JIPMER, my first batch of undergraduates. And I heard one of them referring to me like that. And then it was all right then, because 47 was still the newer model. And subsequently, every batch has called me that, and I've heard them. And I used to ask my son, what do they talk about me? Do they still call me AK-47? And he used to say, no, they don't, and all that. But I never believed him. My only regret was that the several good models have come after that. But
and you never got upgraded.
I never got upgraded to a later model. Every batch, and including the double batch, which Patta and Vidya belong to, and I have lots of very favorite students there. All of them call me that.
So coming to your favorite students, sir, Chandru is on board. So Chandru, would you like to say something to sir? Ramachandran?
I've not seen him for a long time.
Yeah, I've just remembering that I've not visited JIPMER in almost since I left in '89. But Vidya, just to reiterate what I think about anesthesiologists, I remember operating with some senior residents or more junior people when the professors are not around. And then Ravi Shankar would come and say, retract the liver like that, and then you'll find this thing. So, he was instrumental in directing, our surgery. So, we have to be thankful for them a lot. I've always aspired to be a good student to Dr. Ananthakrishnan, but I believe that at least in my own mind, that I can never reach those heights, and I have to thank him for everything. So even these days, when I ask somebody about the Hollander test here, even the senior surgeons here don't know anything about it. So I have to thank him for all the number of made us do those tests in the in the treatment room, in the wards.
So Chandru, I'm happy you brought that up, because Dr. Ravi famously once even there was some nephrectomy going on and in a child, and when the clamp was put on the pedicle, and then just as they were about to tie it or cut it, I believe he suddenly said, what, I think it's the opposite one or something, and then they found. So things like that do happen, and because of simply watching so many surgeries, actually many of us anesthetists who've gone grey now are actually able to, for want of a better word, help the surgeons when they are stuck, even for decision making on the table or anything. So
Vidya,
I think it's a nice teamwork.
Clarify here, I have never done a nephrectomy in a child. People will think that you're talking about me. You're moving the wrong kidney.
No, sir. In the other side, even things like Dr. Ravi, of course, has taught me so much. So he told me once how in an abdominal operation somebody had a line in the leg, in a child, and then things went wrong in the middle of surgery. There was some IVC problem. Nothing could be done because our vein was on the leg. So like that, all of us have learned. From others' mistakes. Similarly, actually, I have worked with an orthopedic surgeon who used to do, who was no longer with us. He's working at the hospital. So some really difficult patients, when the anesthetist used to fail to get the spinal, there are times when he has rescued. So I think we do have a lot to help each other. And one other time, I was again not involved in surgery, but there was an episode where the anesthetist lost airway at the end of the surgery, and the surgeon stepped in quickly and got a tracheostomy in. So I think we, as a team, we are likely to do much better, and that's what we are doing. So your anything else, Chandru?
I wanted to ask Dr. Ananthakrishnan, in your role as surgical educator, what do you think about simulation? A lot of people are doing simulation for, like intubation, for various things. And in surgery, of course, a lot of simulation for laparoscopic procedures.
I think, Chandru, it's a good thing that has happened, because in India, what used to happen before is
you practice for them.
I think I've lost the audio. Can you hear me?
Yes.
Yeah. What used to happen before is people will go and attend a workshop of 3 days on minimally invasive surgery and then come back and start doing it because there were no licensing requirements. And I have been witness to some very unfortunate events in these operative workshops held in conferences, where a visiting surgeon operates in a strange environment, and sometimes things go wrong and unfortunate things happen. So, in fact, I wrote once a paper in the National Medical Journal, Ethics of Live Operative Workshops, and whether it is really good to have that. But I think, leaving that aside, simulations give you a chance to develop your skills in a non-traumatic, non-invasive, and non-damaging environment before you can actually practice on human beings. And I think I am all for simulations. My colleague, Dr. Dinkar Pai, is director of our simulation lab, and he is an international authority on these simulations. And I have seen him work with some of these models. And I think overall it's extraordinarily good. And it should be made mandatory practice of surgical training, not only surgical training, many other branches also, before they are actually allowed to practice on human beings. So I think I am all for it.
So, Piyush, do you have any interesting, funny anecdotes about sir?
Which Piyush is this?
Maniambat, anesthetist.
Our footballer friend.
Yes. Can you hear and see me?
Do you still play football, Piyush?
No.
Yes.
Can you hear me?
Yeah,
I can hear you, but I can see you now.
I don't. I don't. I have given up football around 10 years ago, and I play golf.
Oh.
The interesting thing about AK, as I always refer to him, is that I joined JIPMER in 75, and it's around that period when he also came from All India Institute as a lecturer, I think. Can you hear me?
Yeah, I can hear you.
Yeah. And the association has been very long and pleasant. Then I was in undergraduate days those days, but when I joined anesthesia, the association became stronger. But then, but not like Chandru, but I have been going there on and off and meeting all these people quite regularly. But and I still remember I first met him on the ground. We had a staff versus students match in cricket. That's how I met him, because he's quite a good sportsman. That's what people don't know much. Tennis he played for very long, but he was a very stylish batsman. So that's where I met him first on the ground, because I was still in anatomy days. But then the association became longer, and I do meet these people whenever I go to Jifmar, although I haven't been there for some time now. You got that? Or is it?
Yeah, we heard you. Thanks, Piyush.
Yeah.
I also used to keep wickets.
Yes, but I remember. But now me and some of my anesthesia colleagues who you know spend our time playing golf.
Oh, I wish I could.
The main reason is my knee is gone, actually. It's not. There's a lot of artifacts floating around the joint.
Oh, you still have your original knees. I have lost both my original knees. I have got only 2 metal pieces on both sides.
No, the knees are fine. Knees are fine, but it gets locked. And I do, and it was good to see Chandru also.
So Piyush, Piyush, you got to give us some, spicy stuff on AK, not just about batsman and wicket keeper, something more.
See, Vidya, I've become old and very diplomatic, and I am a writer. So there's nothing which you could point a finger at AK and say it should not have been done that way. There was nothing. These are people who have been role models, which you only realize after a certain age, that there was no pettiness, nothing. They are absolute role models. Him and I always quote Dr. Smiles. They were real role models. And he was a smart man, spoke well, taught well, and had magical...
My wife is laughing when you said that.
Which part was that?
The smart man part.
The spicy bit, maybe, is it?
No, the smart man part.
No, but they are real role models. This you realize only.
Absolutely. So Piyush, I was telling sir how he and Dr. Smiles have spoiled us, right?
Yes.
We expect that in every surgeon, and we don't often get it. So that's really good.
I'll tell you one instance. AK in his unit, when sometimes he will we used to do a lot of GJs those days, which we don't see it now. So he used to ask, shall I do this clampless? He'll ask the anesthetist always. And we used to say yes. But now if I am asked, I'll only say, only if you are doing it. That's one spicy bit that I have. But he used to do that. And I remember that. And it was good to see Chandru also. When I saw him, I remembered his size 12 shoes running down the basketball court, thundering down the court.
I'm glad that something about me played into you.
Sir, coming back to your favorite students, I have Govind here.
Oh.
Govind.
Hello, Dr. Ananthakrishnan. How are you doing?
How are you, Govind? You are in New Zealand, if I am correct. Huh?
I'm now in Sydney. I'm actually, I'll have to give good afternoon while you'll have to wish me good night, but I've not been to bed as yet. I'm in my PJ.
Oh, how are you going?
It's good to see you. The knees might have changed, but your brains are still steady, fast, and working hard. You're still as dynamic as ever.
Oh my God.
Yeah.
I wish my bones knew that.
Govind, do you have any interesting bit about sir or interesting bit about?
Don't ask him about his dissertation, because he will have a lot of bad things to say about his dissertation.
No, I don't have any bad thing to say. But with regard to the dissertation, I still remember going to a sort of a final reading or pre-final reading, I'm not quite sure, to Dr. Ananthakrishnan's home. And the great part was I enjoyed some dosas. I don't
I'm glad you brought Dr. Shanti in.
Yeah, you can see her there.
Yes. Hello. How are you, Dr. Mrs. Santhi? And it's good to see
fine,
you.
fine. Thank you.
And you're doing well?
Yeah, I'm doing well. How are you?
Oh, I'm doing good. I'm well. Yes. And I've seen that you've been a great support for
Hello.
Dr. Krishnan. Both of you are really doing very well.
Hello.
Still
I
look great.
remember Anand telling me about your romance with your wife and how he said you had to change your name to Murugan or Saravanan. I remember that.
I think I have to add a bit more to it that okay, I might have changed, but I have to get back to my original name now that that has gone by. Yeah. Now that I think
So now that, sorry.
the 3 years that I was there with Professor Ananthakrishnan was great, and I think my solid background for surgical techniques were really established there, and I just carried even now many of the things that I've learned from there in JIPMER under Professor Ananthakrishnan, even up till now, practice it, and it's great. He's a fantastic teacher. I've not met anyone I can say in my long career of anyone having taught me so well as him. And I credit my present standing of whatever I am, whatever I'm doing, to directly to him. So, yeah, I actually appreciate what he has really done to my life and my future, and that's great. Yeah.
Thanks, Govind. Thanks a lot.
Now that you brought the dosas in, Govind.
Yeah. What's that? No, I just want to know from how is what's he doing surgery wise? How is he keeping his mind occupied? What else?
Okay.
Yeah.
Govind, surgery I do far less than I was doing before, and mostly those procedures which I like to do and which I get referrals from all over the place. Corrosive strictures, you would have seen us doing a lot of those days. Esophageal strictures. So I do those, and I do a few other procedures for the sake of the postgraduates to get them involved in proper techniques, because nobody tells them even how to hold instruments, and they don't know the names of instruments. So it's a little difficult these days, the environment. But I do a lot of teaching, and I do a little bit of administration, and a lot of medical education, because that was always in my NTTC days, that was my obsession. So I pursue that. So, keeps at least when you get up in the morning, something to do, so that keeps your mind active.
No, just that you've been right throughout your life. During our time, we've seen you like what Piyush has been saying, playing games, playing tennis. So it's really great to see that you are continuing and still contributing to the medical society and the surgical fraternity about everything. That's a great thing, I feel.
My life in JIPMER started in room 342 in Harvey House. That's where I stayed for 2 years till I got married, and that overlooked the tennis court, if you remember.
Because Govind brought in the
Nice.
dosas. Govind brought in the dosas. I'm sure Dr. Shanti made them, right?
Yeah, I think so. Because when he came, I think he came at the time when there was no help at home. So I had to make.
Yes.
So, ma'am, in the early days.
Yeah, early days.
Yeah.
Yeah. Because
early days, how much was sort of a help at home?
Sorry.
Yeah, he used to help a lot. In fact, that surprised many of my friends because he had no alternative. You know, he had twins. And so he had to necessarily contribute much more than what he would have done otherwise. So he was a great help.
Because there's a lot of talk in the learning general surgery group about women surgeons and how they need to, do because they need to work in the hospital as well as home. So I just kind of wanted to speak up on behalf of the guys, but that there are men too who are doing that, isn't it? So
yeah, they do help a lot. They do help a lot, and I think they like to get involved in child rearing and all that. They want to feel part of the scene. So it's a teamwork, as you say, not only in the hospital but also at home, and no complaints on that front with respect to Anand.
You see this about this lady surgeons, I think
so now
a lot of wrong ideas are going around, because I've had a number of ladies working with me, and Kadambari, if she is there, she's one of those early ones who worked in my unit. A lot of postgraduates who did surgery in my unit, Ashita and Sandhya Bala, and originally when I joined, Major Margaret Tokno, who was in the army, and she retired as Colonel Tokno. So I don't see them. You see, when you're in a working environment, there is nothing like a lady surgeon and a gentleman surgeon. They're surgeons and they are all members of the team. This perception that they have a tough time, at least I have not seen it.
Yeah,
maybe it's different in the corporate sector.
Madam, I am working in the corporate sector now for close to
Vidya, you are suddenly very soft. Your voice is not coming through well.
Can you hear me, sir?
Yeah,
now it's better. Yeah.
Can you hear me?
Now it's better.
No, I just wanted to say that I have been working in the corporate sector for more than 25 years, and I don't really see any. I don't see that the degree of negativity that is being projected. So maybe we don't have the full sample size. We are talking of Jipmer and maybe a couple of other places where everything is fine. So if there is so much talk going on, I suppose there must be some, there has to be a truth behind it. But I'm so glad that there are places where it is not a problem. So I just, because it's a hot topic in learning general surgery, I just wanted to bring it up. So, sir is not, not just been a role model or, inspiration for only surgeons. Others too, from my batch, I'd like, Woody, are you there? Woody, Ravi Shankar?
Yeah,
Woody,
can you hear me? Yeah, can you hear me?
Yeah.
Yeah, hi. First of all, good evening to all of you. And good night to Govind, of course. I'm seeing a lot of you after I left JIPMA in 1986. So even before Chandru. And I am a pediatrician. And my only contact with surgery was during my internship, where I decided to do a rotation in surgery, knowing fully well that I was not going to do it ever again. That was an interesting experience, but I do want to say that when I left JIPMA and went to PGI, one of the images that I carried with me, and I still do today, is actually of how Dr. Shanti dealt with patients in the pediatric ward. It's still something very, very precious to me. I'm sure most of you don't remember me because obviously I wasn't there after my MBBS days, but that was a very, very powerful image of how to approach patients, pediatric patients, how to sort of calm them down. And, so it's been a very inspiring role model for me. I know this is about Dr. Ananthakrishnan, but we all know that, we have to talk about everybody, right? So thank you so much for doing that, even without realizing it. I think those are the inspirations that are the best, where you don't know you're doing it. So thank you so much.
Oh, I'm so pleasantly surprised. That's very nice to hear. Because
you're very welcome.
First time or second time that somebody has told me.
Oh,
that
I'm sure.
Good in approaching patients.
No, I'm sure there are a lot more people who feel that way. They've probably not expressed it. Obviously, I didn't express it for all these years because this was the first opportunity to do so. But thank you so much. But Dr. Ananthakrishnan, I've been hearing more of him in his new role because my niece, graduated, did her post-graduation in pediatrics, they had sent me a link to watch her getting an award from Dr. Ananthakrishnan, I think a year ago or something like that. So it was very pleasant to see him then. And of course, Dinkar and his simulations brought back memories of my visit to Malaysia when I spent some time with Dinkar when he was there. And he had talked me through a lot of these things that he was doing, which is amazing work. And so, other than that, my connection with surgery is very peripheral. I've been under the knife a couple of times, but that's about it. So
Dr. Shanti, I just want to add to that because the pediatric department was a very boisterous, not just the children, even the people used to be noisy and, talking all the time. But that's a very vivid image of you. You used to be so calm and you were never appearing to be rushing anywhere, but everything used to get done when you were around. So that is something I have never been able to imbibe because I don't think I can ever be quiet and calm like you. But then I know what.
My God, that's news to me, Vidya. Please say it once again so that Anand hears it. Because he always tells I'm
Vidya,
a very short-tempered.
Vidya, if I can chat in
not
for a
organized.
minute. Suma Balan is on the Facebook group and she says, I totally agree with what Woody says regarding Madam.
Oh. Thank you.
Everybody has
my day.
Everybody has to agree. I mean, everyone will carry that vision of you in your white coat, just calmly going from bed to bed and, just doing your work and then coming back and sitting. Even when you were pregnant, even that time you continued to work, I remember. But, just the calmness you used to exude, I'm sure the parents got a lot of, this thing, positive thing from that.
Thank you.
So AK sir, I have another person for you. Kisco, are you there? William Kisco?
Oh.
Kisco, are you around? I did see him for a bit. Kisco?
Yeah, he's there, but I think his connection is weak, Vidya.
Okay.
While we are on this topic of lady surgeons, is Kadambari joined?
I have to look, sir.
No, she isn't here.
Dr. Patta, can I say something?
Yeah, please.
Absolutely.
And let me introduce General Ravi Shankar is a senior cardiac surgeon and is a CEO of Lilavati Hospitals. Sir.
Yeah, good evening to all. Brigadier Nilakantan, that is Dr. Ananthakrishnan's father, and my father, General Venkatraman, they were contemporaries in the Army Medical Corps for many years.
Oh, you are Jayanti's brother?
Absolutely,
yes,
sir.
Oh,
so in the year...
Jayanti and Shanti are classmates.
Yeah, I know. 1978, I had joined Army and some of my friends had gone to Lucknow and I visited his father's place. palatial bungalow, 4 acres of land. And that is the time I said to myself, although we were also living in some of those houses, that this is the place one should come and stay. As luck would have it, 38 years down the line, I retired as Commandant AMC Center from that very house. The house,
That's nice.
if you go there is a board where Brigadier Nilakantan's name is high up as one of the residents there. Mine is low down. And that appointment got upgraded from brigadier to lieutenant general. Coming to the point about working with the anesthetists, can you hear me?
Yes, sir.
Yeah, cardiac anesthetists work very, very closely with the cardiac surgeons, and anesthetists work very closely. In fact, they don't induce till one of us is in the operation theater, and that's very important in our kind of specialty. And in the armed forces, the anesthetist also oversees the heart-lung machine running, not in the corporate where I'm working now. We have separate. And coming to thank them, yes, end of surgery, we always thank the scrub nurse, the anesthetist, and the perfusionist. And we sit with the patient and the anesthetist till we move the patient into the ICU. So we work very, very closely with the anesthetist. And I think all surgeons should always be thankful to anesthetists to run the operation smoothly.
Yeah, I agree with you.
Okay, so Ravi Shankar sir, I want to make a special mention that I think cardiothoracic surgeons are probably one of the first ones to really acknowledge and make the anesthetists equal members of part of the team. Even in all the press meets or any interviews, anything, cardiac surgeons are the first ones to acknowledge or give equal space and equal importance to the anesthetists. So
absolutely. Years back, we had one association that was cardiothoracic surgeons and anesthesiologists. Later on, we split into 2 different groups but even then, even today, we work as a team, and it has to work as a team. Just not possible. Whatever specialty, I'm not saying only cardiac surgery, but then we do duties together in the ICU, the surgeon and the anesthetist.
So Patta, do we have time or do we need to?
Yeah, carry on. We have time. We have 1 more hour.
Oh, okay. So is Kisku there?
Kisku is there, but his connection seems to be weak, and I can't see his audio symbol.
Okay. Urdi, are you there? Urdi, are you? Never mind.
Ramasubramaniam is there.
Ras. Subramaniam?
Yes, Vidya, tell me.
Okay. Hi. Do you have any fond memories with sir, or not so fond memories as well?
Because I was away from surgery, whatever memories I have is only as an undergraduate. Because after that, I moved out from Disma.
Anyway, so,
but
other than
because being a gastroenterologist, I hear a lot of things about him. He has done a lot of good work in gastrosurgery, and wherever we have common meetings, I used to see a lot of his papers and work, especially in corrosive, in H. pylori research. He's a pioneer in all this. And I was told he's one of the examiners for MCH earlier on in All India Institute, which is a real honor those days.
Vidya, if I can ask Dr. AK a question, because I keep appearing in this forum all the time, so I didn't want to say anything. But then, see, in surgeons' meetings, say we have 3-day, 4-day meetings, there's no anesthetist involved, no anesthesia topic comes in. Likewise, in the anesthesia conference, there's no surgeon comes in. I mean, why does this happen? Don't we work together? We have so many common problems which are never discussed in any platform. Actually, I tried to do a meeting in Chennai, but it didn't really work out because the anesthesiologist backed out. I just want to know, from Dr. AK, that how can this gap be bridged?
You know, if you take the example of the Indian Society of Gastroenterology, they have a lot of membership of surgeons, anesthetists, and stoma nurses, and all other people. It's a very wide representative body. But if you take the surgical counterpart, the Indian Association of Surgical Gastroenterologists, hardly you have anybody from allied specialties. That's a very strange thing here, because whenever I've gone abroad, I've seen most meetings are interdisciplinary because we deal with problems as a team, as a unit. I don't know why, because in India, I have never gone to a meeting where we had anesthetists and surgeons together sitting and discussing any issues, whereas every day of their life, they have issues to solve together.
Actually, the Association of Day Surgeons is probably an exception.
Daycare surgeons?
As a day surgery, not not surgeon, day surgery.
Day surgery.
Patta was part of organizing one of them, and there it was really nice to have nursing as well as surgeons, anesthetists, the works, everybody together. So maybe Patta, it's time for you to do something. We should have a
no, Patta once organized a conference on day surgery where I gave a talk, and we had a lot of anesthetists there. I remember Pooja Bagdi and all that. Remember Patta?
Yes, sir. Yes, sir.
So they are there.
The guest of honor, if you remember.
So we need to do something about this.
Sir, you are one of the founding fathers of Indian National Surgical Gastroenterology. Why that concept was not brought in? But still, you have enough influence in that area, and then you can still show some way in that particular area.
We should.
Vidya, if I can ask you the same question, why is that the surgeons don't appear in your meetings?
No, I think it's just become traditionally that, actually it would probably make more sense because we need to take time off at the same time. So even logistics wise and even running a department or even in a corporate hospital, probably it makes sense for us to have our conferences at the same time so that, we actually, let's think about that. But I think one thing I have to hand it to Patta is that though learning general surgery is basically a surgeon's thing, there are a lot of anesthetists and many of us actually do find it very useful. Some of the subjects may be too technical, then we back off. But probably in any surgery conference, we should have, if it's a 3-day conference, then we should have a half a day at least, which is common between both anesthetists and surgeons. And similarly, any anesthesia conference, I think, should have at least, half a day where we interact actively. So because there are so many small things, even to roll out an ERAS protocol, say, it's such a problem because we don't seem to be, able to get our act together. So I think in the long and even for joint publications or any study, anything. Though workshops, normally what happens is it's a surgical workshop, so the anesthetist just comes quietly, gives anesthesia and goes off. So nobody even knows what's happening. Again, exception is Patta's, any workshop that Patta conducts, there we have equal, the anesthesia part is also explained and that is also discussed, pros and cons, benefits, everything. So maybe we just need to start, simulation is one area where we are really doing it together. Like Dinkar Pai, though he's a surgeon, he all the simulation workshops that he conducts, they have across the board all kinds of things where the anesthetists, intensivists, ER medicine, surgeons, everybody attends together, and we can benefit from each other. So I think that is something to look forward to. That's definitely something to look forward to.
So, General Ravishankar, what is your take on this? Other than cardiac anesthesiologist, how do your surgeons anesthetists, how do they work together? But you have to unmute, sir.
Yeah. See, we have a very large team of anesthesiologists, and some of them are super specialists in their own fields. And of course, ours is a tertiary care super specialty hospital. They get along very well. I mean, it's I've never had any problems with anybody ever complaining. Yes, there are surgeons who prefer a particular anesthetist. Now, that system doesn't work in our place because the roster is made by the coordinator for different OTs. But there are some very senior surgeons who would come and say, I want this particular anesthetist. They're more comfortable. It's just a question. It's a comfort zone because they've been operating together. So there has to be a leeway with some of the very, very senior people. And I try to, being a CEO, I have to balance both ways. And then it affects the anesthetist. They feel that, why is it that so-and-so is better than the other person? You know, those things come in. But in the corporate world, you got to balance everything. It doesn't happen in the armed forces. It can never happen. But here, it's a different ballgame.
So, but actually, I can't remember the exact publication, but in obstetric anesthesia, there was a study and it was published that actually the team's outcomes when the same teams work together is far superior. So, it may not be just a matter of comfort. It's actually, it's like your 5-year-old car. You and the car are like, one being. You don't even know when you started the car and reached. So like that, sometimes long association teams that work together, probably outcomes are actually better. But then you may not be able to hold a team for very long. But it's not only comfort, sir. I think there is some proof that actually the outcomes are better when teams work together.
I absolutely agree with you. Certainly. Except that sometimes you don't get that particular anesthetist. They might have been on a call the previous night. They're not available the next day. So, certainly the team which works together understands each other's way of working, the sequence of events, and it does matter. The results would be better, I guess. Yeah.
I remember when I joined All India Institute, same was true even then in the early 70s. Dr. Venugopal, Dr. I.M. Rao, Dr. Punnus in anesthesia, they're all part of a team. They never used to be seen separately. Dr. Gopinath. So, I don't know, it's an extraordinarily happy thing which happens in cardiothoracic surgery, but we are not able to duplicate it.
This is the only specialty where I've seen we work as a very, very close-knit family. Wherever I worked, in the armed forces as well as now, it's always together for everything because we struggle together. If the case gets prolonged, we are sitting together. We do night duties in the ICU together. The bonding is much, much more. It is a cardiothoracic and anesthesia team. Like I said, years back, there was one association. So that itself gives you the impression what it was.
Yeah, I think actually, another place is pediatric surgery. So as anesthetists, we just love our pediatric surgeons. Somehow, it's so easy, even whether it's corporate, it's government hospitals, wherever you go. Again, I think it's the common thing about, struggling with the child, staying with the child even after everything is over. I think the main essence is when the time spent together is probably what determines the feeling of being part of a team. Patta, you were going to say something?
Yeah, actually, because I wanted to ask Dr. Ananthakrishnan a question which I didn't ask in my previous interview. That all surgeons are once they finish their tenure in the government sector, they'll get into some big corporate hospital. And for him, Chennai is the second home, or maybe even the first home. Why didn't he think of anything of that nature and stayed back in a small place like Pondicherry? What made him stick on to that place?
See, I did my undergraduation in KMC in Chennai, right? And then my post-graduation at All India Institute. 7 years I was there. 30 years I spent my career in JIPMER. from 76 to 2006. So, never developed an attraction for the corporate world, because in these places where I worked, you treat patients according to merits. It does not matter whether their paying capacity is good or bad, or because government provides everything. You may say it's unfair, but that is how it is. Some section of population is there which has to be provided by government. So when I left that, I went to government medical college. But unfortunately there a lot of politics, and then I went into the private sector. But it's not a corporate setup. There is no charges for the patients. So somehow the atmosphere of the corporate sector was not very strong, and my attraction towards teaching was so strong, and my attraction towards medical education was so strong, that I just did not feel like pulling my roots off Pondicherry. Pondicherry was a good place those days. Only in the last few years it has become just like any other place in Tamil Nadu. But it's still different. You have your peace, and one end of the town to the other is only 5 kilometers. Everybody knows everybody else. So it's a nice place to live.
And why is that many of your good students didn't follow your footsteps?
Didn't follow my footsteps in joining academic. I think a lot of them are. Because the number of vacancies there are less. Now, if you see, I have Nand Kishore who is in surgery. I have Kalai Arasan who is in surgery and in surgical gastroenterology. Then I have Gopalakrishnan in neurosurgery. A lot of people in JIPMER. As and when they get, they will come and join there. And many other people tried to get in, but they could not find vacancies. So, but JIPMER is not the only place. I am not saying that there are no centers outside of JIPMER. But the environment in academics where there is a combination of teaching and research and patient care is something that keeps you occupied. And I never really felt the need for going into a strange environment and becoming competitive. And the flip side is also true. I never got an offer from any corporate sector. So maybe they know that I won't fit in.
I mean, you never opened your door to...
Actually, I just wanted to say now that I had been wanting to say this, that though JIPMER, like you described, is a place where we don't have to worry about economics. We treat all kinds of patients.
No, I want to tell Dr. Ravi Kumar this. Dr. Balakrishnan is my student, and Vidya knows him. He is now gone into the MGM healthcare, and he and his anesthetist team are also always together.
The care Balakrishnan.
Yeah, actually, Suresh Rao, who's Suresh Rao, who's the anesthetist, is actually the sometimes
Surgeon.
will be the only one who's leading the press meet or whatever, and he's completely in charge of the ISCO, and KRB listens to everything that Suresh Rao says and all that. So I just want to backtrack a little bit. Though you said that the academic atmosphere, it's something to be said that in a place like JIPMER, people who were trained, we have managed to actually fit into all kinds of organizations. Some of us are in academics like you, corporate sector, somehow you have managed to impart the necessary skills and softs as well to help us to survive in all kinds of environments. So thanks a lot to you and the other teachers in JIPMER that you didn't put it to a narrow path or anything. You made us fit to do whatever we chose to do or whatever we had to do, sir. So thank you so much for that.
No,
it's
a two-way street, JIPMER students, I've been in All India Institute. Students there are a little different. They have a chip on their shoulders sometimes. It's difficult. But JIPMER students are extraordinarily good. At least during now, of course, we had only 65 students till I left in an undergraduate batch, except for the double batch. And then in the previous batch had only 30 odd students. Now they have got 150 students. So it's become very much like any other college at the hardly any room. But otherwise, the undergraduate teaching in JIPMER, all departments, starting from the anatomy, physiology up to the clinical side, I think is still very, very good. I have been in All India Institute, I have seen undergraduate classes there, I have taken some myself. The teaching in JIPMER is far, far better, superior, and it prepares them for all walks of life after they qualify. And I don't think anybody there tries to push them into one or the other. And just as I have students in all walks of life, everyone there has students in all walks of life. So I think it's an environment which nurtures people, and not only that, Pondicherry, there's not much to do outside the campus. At least I know a few things to do, but not many people used to go there those days.
Sir, I have to add to the. Sorry, Vidya, can I just add to the things that you said? So I probably am the only person on this call today who works for a pharmaceutical company, and I echo every bit of what Vidya said. There is not a single day, or several times a day, that I reach back into what people taught me at JIPMER. And if I talk about pediatrics, it has to be from PGI. And, everything comes back to those wonderful teachers. And so I really want to thank all of them. Obviously, they're not here on this call, but we cannot say enough. And I don't think it has much to do with the fact that we didn't have other distractions. I think you guys were phenomenal.
Shaitan.
Shaitan, you wanted to say something?
Yeah. Dr. Anjali, you have a
Shaitan,
comment?
Unmute your...
Yes, sir. Yes, sir.
Yes.
Basically, am I audible, sir?
Yeah.
Yeah. Okay. As
please introduce yourself, Anjali.
Yes, sir.
Introduce yourself and say what you want to say.
Okay, sir. I am a practicing general surgeon since
Can
last almost 9
you put on your camera, please?
Right, sir.
Anjali, we can't see you.
Okay, sir. I am presently doing ultrasound, madam. One of the patients.
Oh, okay.
That is right.
Okay. Go ahead.
I am practicing surgeon since 19 years in the city Nanded in Maharashtra. My husband is anesthetist, and now my husband has worked in the government hospital as well as now working in the private hospital. Now the surgeon and the anesthetist harmony. I think the level of thinking is that is different at every level. Now my husband always says, being an anesthetist, that we think about the safety first. We have high degree of anticipation, and surgeons, they give preference to the what is on table situation. They give the preference to. That is what his thinking is, and they have a high thinking about the painless, how painless it can be made during surgery, post-operatively, and long-term post-operative also the outcomes are variable. Now here when we started practice in Nanded, sir, he was interested. Now he has been trained from Nair. He has done his anesthesia from Nair Hospital, Mumbai. Now in a teaching hospital, the level of anesthesia, the anesthesia equipments, the drugs which are available are totally different. But when you come into a private practice, and that too a small medium setup, the anesthesia drugs, surgeon will always try to reduce the finances, that you can use this drug, this can be done, and various muscle relaxant, induction drugs, the disposable endotracheal tubes, even the ABG machines, the anesthesia gas monitors. These are some of the basic requirements for the anesthesia safety, by which anesthetists feel that he is in a comfortable zone. He can work in a comfortable zone. But if they are not there and he has been trained, sir, they feel uncomfortable. And now the present situation is, sir, Now, although we are working, we are doing laser, we are doing endoscopy, and I do not think that in a single day, throughout the day, I cannot work without him. Now the situation is, we have been a team, sir. He can do, I always say that for some or another reason, if in between the operation, there is some problem and I have to withhold due to some reason, he can do that. And in the anesthesia also, sir, if some problem occurs to my husband, but I cannot help much in the anesthesia. This is a real situation. So anesthesia is a complex job. It's a really complex job, sir. Now he has been shifted. Now he's the only anesthetist in the town, sir, who has a capnometer, who has a ABG monitor, who has the anesthesia gas monitor. He has video laryngoscope. He has all types of advanced anesthesia equipment, and he always say that if I am unable to intubate you a single patient, people will not blame me. People will always blame that there was some always anesthesia problem must have been there, and he could not realize what is the real situation, because we belong to a same house. So the problems are different in the private and government setup. So my take is, sir, anesthesia is very a complex job. The responsibility and the time interval given if any accident occurs is very, very less. So these are some of the real situations, sir, where this was my comment actually.
Thanks. Thank you, Anjali. Thanks.
Actually, I'm so glad that being a surgeon of this issue, which is one of the burning topics in the anesthetist and the anesthesia society, the two Facebook pages which are sister pages to learning surgery. So I would like to use this because this is going out live on learning surgery. I would request all the surgeons to listen to this and realize that equipment bought for anesthesia is going to improve the safety of your patients. If you can buy a laptop set worth whatever number of lakhs, I don't know, definitely you can spend a lakh or less in trying to get a CO2 monitor which is going to improve the safety. If you can buy some very advanced diathermy machine or ultrasound or whatever, endo ultrasound or whatever, surely you can spend at least 1/10 of that amount for buying anesthesia equipment, which would improve patient safety, and which would also cover you for any liability if something goes wrong. So thanks, Anjali, for bringing up that.
Yes, right. So the thing is, madam, the level of thinking is always different, madam. The anesthetist work on a different forum, and surgeon they think on a different forum. But at the end of the story, both are working for the betterment of the patient. But anesthetists do not want any accident by mistake. That is the important line. He don't want to have an accident. Instead of taking the post-accident measures, they will always try to avoid the accidents. That is the basic level of thinking of an anesthetist.
So, Vidya, coming back to Professor A.K., another question I wanted to ask him is that what are the achievements he's proud of, and what are all the things he feels that he couldn't do and is helpless about it in his long career?
What I'm proud of are my students, because in the Hyderabad conference of the Indian Association of Surgical Gastroenterology, suddenly we realized all over India there are about 80 to 90 people who are in surgical gastroenterology and who have passed through the portals of JIPMER during my tenure there.
Wow, sir. Wow.
So we also had a photograph taken, and I have it in my thing, and they are all over the place. From transplant Ravindra in Duke University in North Carolina, everywhere. So they are the ones that I always remember. Secondly, even in a government sector, with a lot of restriction, and coming back before, just to answer Dr. Anjali, those of us who trained in the 70s and had a career, we never had any vessel sealing device. Diathermy was a luxury. That's why most people were adept at making knots. And if you could get a working diathermy, that day was heaven. We had no other vessel sealing device at that time.
Yeah,
you get used to what you have, and you make do with that. The second important thing I wish to remember is that even in resource scarce settings like government sector where there's not much money for research, I was able to motivate a lot of my students, both as postgraduates, to do a dissertation which is meaningful and which contributes to literature and which could be published and which they could be proud of. And I think we have set a tradition of research in the Department of Surgery, and probably we are the center which has contributed a lot. I don't know if it's maximum, but a lot to the management of corrosive strictures and a lot to knowledge about the Helicobacter pylori and allied diseases. Other than that, what I regret is that somehow we don't have quality control in admission of students where I work after retirement. And admission to a lot of places depends on availability of money. And therefore, we have a number of students who come there and tell us even on day one, look, I've just come here to get an MS and I have my father having a nursing home or somebody running a clinic and I'll go back there and learn. And we don't find the same dedication to getting knowledge because these 3 years are exceedingly important. You can make mistakes and be protected by somebody else. Once you qualify and go out, you make mistakes, they will come back to haunt you. But when you are in training, others are there to take responsibility and you have to learn the fundamentals. That is the regret that I have, that the quality of students that we get should have been better. But unfortunately, that's the situation nowadays in the private sector, where you need to have money, and if you have money, you'll get a seat. And that's about the only regret. Otherwise, I don't have many regrets. I think I've had a very good students, a very good career, very good institutes where I work. And I really can't think of anything that I would have done differently from the day I set my foot into Kirkuk Medical College Hospital till today.
Now, if you can ask Madam Shanti about a few words about Dr. A.K.
About AK? What? As a husband, as a father, as a friend?
Yeah.
Everything, ma'am, everything.
He has been...
Do you want me to stay or shall I go out for 5 minutes and come?
You know, he's a... What shall I say? He's a homebird. He's very fond of his home, his parents, his relatives, and that's his priority. His students and his home, they are his priority. And he's been a good support. We've had several quarrels, that happens in any household, but they are all very trivial. But on the whole, he has been a source of support for me and my, what shall I say, in bringing up children. And I did my MD, I did so many things only after getting married. It would not have been possible with twins and to do a degree without support from home. And one thing is, anything to do with academics, he will give his full-hearted support. On many days, they have lived only on curd rice. And he's not demanding. That's one great thing I like about him. He's not at all demanding and he's willing to adjust to anything you do. Any academics, he will support you fully. And apart from that, and he was very much involved in bringing up his children. And I was never alone in any of these things. He was always there with me, supporting me and helping me. I think Dr. Patta would have seen how he was when I underwent surgery.
What makes him angry?
Oh, he's very short-tempered. See, is that Anusham, you know, those who are born under Anusham are extremely short-tempered. They have a very short fuse. And so if he says, Shanti, come here, the next second I must be there. Otherwise, he'll start telling, what are you doing there? I have other things to do and all that. But it'll just evaporate. I got used to his yellings and shoutings.
What is that you don't like in him?
They're all very trivial things, but
difficult to describe in 5 minutes. You have to
no, but any wife who will find fault with the husband, you know, his sense of, see, their sense of cleanliness and orderliness is different from a female point of view. Some very stupid things like he'll switch on the fan, forget to switch it off. He'll switch on the light, forget to switch it off. Turn something on, forget. So I always think you're like a woman, you know only how to switch on, you don't know how to switch off, come out. So those are all very trivial things. Come to think of it, the disagreement has been on very stupid and silly things, not on major ones.
Vidya, back to you.
Ma'am, have you managed to train him? Ma'am, have you managed to train him to make dosas? So
Yeah, he makes dosas.
Govind comes, he
yeah, he makes dosas, but he's not very fond of cooking. So he just makes, that's all.
Not something that Govind will approve of.
If he makes 5, 3 will be burnt and
Kisku, can you hear us?
Kisku seems to have a big feeling. Anybody else want to comment, please, from the audience?
Okay.
One thing you don't know about me is I also write poetry. And
yeah. I remember your poetry on Facebook, sir. Let's have a new one, sir.
Yeah, I had one which I wrote during the COVID times, which made my wife cry.
Yeah, because we had
this
lockdown.
Just read it out, sir.
This lockdown, we were fighting like whole day cooped up, no? So we had a lot of misunderstanding and we were not on talking terms for 2-3 days. Then he wrote the poem and showed me. I just cried. I said, I'll never again do this. And so far, I've maintained my thing. Because I am also touchy, no? Small things, I'll get angry, I'll sulk, I'll say, I won't talk to you. And, you know, it goes on. So after reading that poem, I changed.
Sir, could you please read that out, sir, for us? Could you read that?
No, I don't have it here, but I'll put it on Facebook sometime.
I think it's applicable to all couples.
I'll put it up. I wrote one about the examinations and postgraduates, and that also I'll put it up.
So, Anbaragan, would you like to say something?
Which Anbaragan? I have lots of Anbaragans as students.
I can't see his camera, sir. So, Anbaragan?
Where is Dr. Debashish?
Yes, sir. I am Dr. Debashish Nayak. I'm a practicing cardiothoracic and vascular surgeon at Apollo Hospital, Bhubaneswar. And I did
Hello,
my
Debashish. How are you?
I'm fine, sir. Good evening, sir. How are you, sir? Lovely to see you.
Right.
Actually, I was senior resident under Dr. Ananthakrishnan, and then I did my MCH from JIPMER. And now that I work in a private corporate hospital, I know both sides of the fence, and I can talk about it. He's absolutely right on point that, you know, we don't decide on the basis of what patient needs what surgery. The most important question is, can he afford that surgery? And I mean, can we do this surgery or say for more than 1 lakh rupees or something like that? That is, we never discuss these things in JIPMER. And the other thing that people don't understand about Ananthakrishnan sir is his wit and sense of humor. He had a very, very deadly sense of humor, I can tell you.
A wicked sense of humor, which
I'd like to tell one thing, Patta.
Yes, sir.
In JIPMER, given the financial situation, our surgical results were no worse than anywhere in the world.
True.
Starting from minor things to Whipple's section or linorenal shunts or anything, no worse. And all totally free for the patients.
True. Very true.
The great thing I've seen, sir, I've seen only in two people. One is you, and other is Dr. Samran Nandi. Their commitment. See, your post-op rounds are notorious. We often keep wondering. See, because if as a corporate surgeon, if I have to visit the hospital now, that's money. It's all money. But you did it all your life, day after day, and I know what drives you to do that, sir, because you go home and come back and do the round in the night. I don't know how many senior consultants do it now in the government sector.
It's become a way of life, That's how it is.
Doctor, yes.
No, probably feels responsible for the patient, no? He used to feel responsible for the patient, and he used to go after dinner to do his post-op rounds.
But does sir get upset when some patient is not doing well?
Yeah, he'll get upset. And particularly if it's due to some negligence or silly mistake that could have been avoided, he'll feel a lot.
I want to tell a little story here. Vidya, this thing, the disease which is very close to my heart is corrosive strictures, right? And these are very poor patients who in a moment of madness take acid or alkali or anything, and lifelong suffering. And they go from place to place, place to place, place to place. And ultimately, they come sometimes, I had people coming from Bangladesh and Nepal all over the place. Now, the thing is, these are porous. They are malnourished. There is a contracted extracellular volume. That's where the importance of teamwork comes. When I was in Jipmer, we have done hundreds of these. We have a set team, they know the protocol and I know the protocol, so I don't have to look beyond the screen and they don't have to look the side of the screen, and things go smoothly. When you induce these patients, and a little later also during surgery, all these drugs which we use are basically produce vasodilatation, and the blood pressure drops. Now, all my life I have been telling them, do not give vasopressors when I have a conduit which is based on one vessel. There is a 20-inch long colon based on the left colic vessel. Because of all the vessels in the body, the ones which are most sensitive to vasopressors, both the arteries and the veins are the splanchnic circulation. And some time ago, I had a patient. We needed a long conduit because it had to go to the pharynx. We were mobilizing and then we brought it out and then we were trying to make a tunnel. And she had a previous esophageal perforation, so mediastinal fibrosis and all that. So ultimately subcutaneous. But then I found, instead of giving volume replacement, we had somebody new. They had a cocktail of 3 vasopressors going. And you won't believe that in front of my eyes, within 15-20 minutes, the conduit changed color, the vessels went into spasm. It would never have happened if there had been a single team, because I don't blame them. It's the first time he is seeing a conduit, and it's the first time we are working together on a conduit. We lost that conduit because it went into spasm. We could not get the vascularity back, and we had to resect it and then leave the patient without a bypass and to fight a battle on another day. So that's why I personally think that teamwork is extraordinarily important, and I discussed it with all my current anesthesiologists, and we decided that on the day before we will all sit together and discuss the issues, because they may not be familiar always with some of the issues which are there in special situations. And for them, it's probably justified when there is no loss of blood and blood pressure falls to give vasopressors. They don't link it to what can happen in the mesenteric circulation. So I think teamwork makes a lot of different. Never happened with me, with LJ or with Ravi Shankar or with all the other people I worked with. It happened for the first time and we lost a convict. And I felt terrible after that because that's probably the only time the patient had of being able to swallow. And we had denied that opportunity to that patient.
Vidya, back to you.
Team meetings are extremely important, and plan for what to do. Another thing which I have found, which I was dead against before, but I have come around in the past 4-5 years, is clinical pathways. Some kind of protocol that is made for any particular surgery, and irrespective of who's the surgeon or who's the anesthetist in that hospital, we follow that. Obviously, we can't be blinded. We have to change if there is some difficulty or something. But that has helped us a lot in this kind of problems. That we make a clinical pathway. This is how, when the patient comes, these are the investigations we are going to do. These are the things that these are the people the patient is going to see. This is the anesthetic technique, which will be the preferred technique unless there is a contraindication. This is how the pain is going to be managed post-op. Things like that, which both surgeons and anesthetists, we sat together and formed the protocol, and then it has worked very well for us for things like single sitting, bilateral knee replacement, and for bariatric surgery. But for most other things, of course, we've not been able to come up with something like that. But maybe it's worthwhile for your department to form some kind of clinical pathway for your colonic replacements or whatever. That may help, because once whoever's coming for the case will know this is what is normally done.
Vidya, if I can ask you, Professor AK may not ask that, but on his behalf, if I can ask you, there's something you always wanted to tell surgeons, but you never said.
Wrong person you're asking, Patta. At the minute I think it, I say it. So totally
we want
wrong.
to hear. See, these things are never spoken in public, because I really don't understand. You watch a surgeon do a lap chole in say 15 minutes. You also watch a surgeon do lap chole in 2.5 hours. How can you withstand that? How can you can be witness to that? And you just treat everybody the same.
See, all of us are not gifted the same way, right? I mean, each of us. I think surgery. One of the reasons I didn't take up surgery is because I thought I didn't have the hand skill for that. Meaning, if you want to be like say embroidery or art or painting, I was never great at it. So I equated that to being the hands, the God-given hands for surgery. Somehow I didn't think I had it in me. That was one of the reasons I never even considered being a surgeon. So I can kind of empathize with those who struggle a bit or take a little longer. But obviously,
You're very diplomatic.
Stupidity.
I'll ask Piyush to pitch in and make his comment on this.
But one thing, nobody takes 3 hours when it can be done in 1 hour. Deliberately, nobody will do that, because whenever somebody asks me, and very often they ask you want to start a case at 1 o'clock. I don't know, in the corporate sector, this will not be there because you finish the list. But in academics, it happens because they have class and we have class and all that, and post duty off and all sorts of things. And I tell them, I do not know. Will it be over in half an hour? I said, I have no idea. You start, if you feel I can finish, it will take whatever time it takes. But I don't think time should be a criterion, but there are, of course, people who take unduly long time. But over a period of time, the learning curve will improve and they'll take less time.
Actually, what I have seen, what I normally do is, if I really think that they are struggling, see, they are taking long because they are being meticulous, or a case is difficult, that's different. I am quite blunt. I'll just say, shall I call XYZ to help you? Do you think I should call this person? So that way my surgeons are, oh yeah, yeah, right, call that person, or whatever. So I make myself a team member whether the person wants or not, and my two bids as well, because sometimes I have seen more of that surgery than that surgeon has done or seen, because now I've been in the business for close to 25-30 years. So I mean, I don't hesitate to give a suggestion. If I know probably you know what, maybe you need to open, it's supposed 2 hours are gone and they're still struggling, then I might say that maybe we should abandon lap and go for open, or I don't hesitate to speak my mind if I think I have something to contribute, if that's what you're asking.
Would you also give that suggestion to AK-47?
But I don't think I'll ever be in a situation where I'll know more than you, sir. So, but yeah,
no, that's not the thing.
Maybe if you're trying.
Three most important things which I tell all my students is, in surgery, the most important thing is to know when not to operate.
And when to call for help.
The second thing is, there is no shame. There is no shame in asking for help. If you are in a situation where help is required. And the third thing is, know your limitations, and if you know you cannot do it, send it elsewhere where it can be dealt with. And if they have learned these three things, I think they have learned all the principles of surgery.
So actually, it's even more valid for anesthesia, sir. And Dr. Kangle's one take-home message that I carry for the past 30 years is that know your limitation. And that has helped me steer clear of trouble all these years, that I've never got into a situation from which I couldn't get out because I know my limitations. So thank you for
I'll tell you a story.
That, sir. Yes,
I had to do a Whipple's operation on the Chief Secretary of Pondicherry. And he was a very nice man, but family very difficult. And I had no hesitation. You see, I have done lots of Whipples, but I had no hesitation in asking Dr. Smile, just hang around. I may need you. So there's no harm in that. He would have done the same thing if he needed me. There's absolutely no shame in asking for help.
Now, Piyush, what is your call?
Sometimes.
Yeah, can you hear me?
Piyush, when you see a horrible surgeon, would you open your mouth?
No, see, as AK says, everyone, there is a learning curve. And in the initial bit, a little bit of struggle should be overlooked by the anesthetist so that they get confident. Right from beginning, you take out the big whip, then nobody will learn anything. So that's one point. And I still remember that 1 o'clock gray area, whether to start the case or not. Big gray area there was. The PGs who you are friendly with will come and just give a spinal, we'll finish it off, So that gray area was there. But I've seen this people struggling in the middle. Everyone has struggled in the beginning. And I after I came back from England, I found that a lot when many people who trained in England and came back and they struggled on their own. I don't know why the system was little difficult, but a lot of people, as Vidya said, used to take inordinately long time to do what you don't expect them to take. But, I have always been friendly with all the surgeons, and there is a lot of give and take, and I keep it in mind, the thing that I was also like that once upon a time. That is one thing I always keep in mind. There is struggle a little bit in the beginning, but they all become very good.
So actually, sometimes I have this peeve that not with all the surgeons, but some, like when ultrasound came first and we started doing the blocks, we were also learning, right? So they'll say, no, why do you have to give the block now? You give it in the end. You have to give, this patient won't have pain, this, that. So at one point, I actually told a surgeon, I said, X, I remember when you took 5 minutes to get the first port in, I supported you. When you needed 2 hours to do a lap chole, I supported you. So if now my registrar takes 10 minutes to give a block, don't you think it's time for you to support us? So I think as seniors, we need to, not worry about being popular, and some things need to be said, and when they need to be said, you should just say them for the good of everybody. So yeah, because sometimes when a surgeon gets very involved and they don't realize what they need is help. So as a part of the team who wants the best for both the surgeon and the patient, there's nothing wrong in suggesting that maybe this is the time to call for help. It's not that that person doesn't want to call. He's just got so involved in the procedure that didn't realize that, maybe calling for help is the best step at that point. So, yeah, I think, Patta, you said that, is there something that you wanted to say that you didn't say before? No, because I almost always say what I want to say then and there. So, Anbaragan, you wanted to say something?
Hello.
Anbaragan,
Hello.
Yes.
Yeah. Can you switch your camera on?
Yes, Anbaragan.
Yeah. It's good evening to everyone. Hello.
Hello, Anbaragan. How are you?
Hello, sir. Fine, sir. I am very happy to see you and madam today evening. Most of the time, I'm a silent watcher. Whenever SAS programs comes, I used to come and see SAS and get to basically have this social sinus as well as it's always last 20 years. Whenever Sir is there, I used to watch him from the distant. I used to run away. The same fear and whatever that Maryada is still in my head. But sir, he is like a father to us. He was in the time of retirement when I started my surgical career in Chennai. Sir is always like a father. I thought so many times what he did to me, and I deeply thought because every once in 4 days or 3 days, I used to remember him. Whenever I see a difficult case or something teaching to the students, I remember suddenly, sir. Then I thought, whatever his way is, he transformed his ideas to us without much difficulty. We all got his ideas. I thought that only. I'm really happy to see you, sir, again. Very thanks a lot, sir. Whatever I'm doing in my life, whatever I'm the present situation, it's purely I can dedicate all these things due to the sir, because my attitude in about this medical career is entirely changed after I met him. Thank you, sir.
Actually, Professor AK might not
we finally have Kisco.
Yeah, just a comment.
Finally have Kisco. Okay.
Oh yeah. Before Kisco comes in, Professor AK might not realize that he's influenced every single MBBS student who's gone through JIPMER while he was there. Everyone, because we only remember a handful of faculty all our lives. I'm not saying because I'm a surgeon and he's on the program, but that is the fact. Kisco, are you back? I don't know whether his camera could come in. I remember when I was a house surgeon, there's one Telugu anesthesiologist, one girl was there, and she used to take half an hour to give spinal. Sir used to come 2-3 times I've seen, scrubbed in, and then he'll just drop his hands and go away. Then he'll go to his room, and half an hour later he comes. I don't know whether sir remembers that. Now, how do you deal with that, sir? Would you call up the anesthesia chief, say, no, when I'm coming for the case, please don't bring juniors in?
No, nowadays they have ultrasound. Does magic. Nobody can take long to put an epidural.
Dr. Vinod Rathi.
No, but
Kisco, can you see us? Kisco's video is on, but audio is not.
I don't think he has. I don't think sir has ever told the chief of the unit of anesthesia to not send a person, nor has he ever discouraged anybody when they were struggling. If somebody took some time to give spinal, I don't think he's ever said why didn't somebody else do it. I don't think so. I don't remember sir ever saying that to anyone.
No, he never discouraged me.
Kisco, can you hear us? No, he's frozen. Okay, never mind. So, Patta, any closing comments?
All that I would like to again know from Professor Reke's long career, that how could he maintain such a nice relationship with his anesthesiologist? How does he treat them outside of working hours? And what is the advice to younger? These days, especially in the government sector, there's no great friendship between surgery postgraduates and anesthesia postgraduates. For that matter, Vidya, I should admit that in JIPMER, I used to hate anesthesia. As a PG, if I go wake up a senior resident or junior resident and say for a duodenal perforation, says bring down a temperature, improve the hemoglobin. I've been troubled so much. I remember I can take names, but it's not nice. But that's how I don't know how is the situation now, and how those things can, because I'm in corporate sector for a long time, so now it's a different world altogether. But otherwise, I always felt, especially the junior level anesthesiologists in the government sector, think that they're doing a favor to the surgeon and not to the patient. I want Professor Ake's comments on this. And
see, I learned very early in my career that ultimately all our aims are same, that the patient should get well and go outside feeling happy with his experience in the hospital. Now, when that has got embedded in your mind, you don't really try to find fault and assign blame and say this is because of you, this is because of me, and all these things. And because they are doing their job, we are doing our job. We may not always agree, but ultimately both our aims are same. So I never had any serious issues about this with any of the anesthesiologists I worked with. We never had to have an argument. We had some argument about 1 o'clock, as Piyush says, because the patient will be waiting and he has to go back, his whole family is there, livelihood is lost. And we feel that we could have done another half an hour or an hour or so. But besides that, never had an issue, because you realize very early, particularly in academic life, what interest we have. We are not competing with each other. We are not competing for money. We are not this thing. So we are doing it because we want the patient to be better. And that has never been an issue. And I think the relationship was good, because if an anesthesiologist brings relatives for you to operate, I think that is ultimate recognition. And that has happened to me several times. So I think I passed that test where they don't consider me a murderer with a knife. And I don't consider them a murderer with an endotracheal tube. So I think relationships build. And you just have to tell yourself they are doing what they think is the best, and you are doing what you think is the best. Time may be an issue, but things will solve themselves.
Any comment? Yes, Vidya?
No. I wanted to give Kisku a last chance if you can hear us. Kisku, can you hear us?
No.
No. Okay.
So I think we have run a good 2 hours in this discussion. Woody has got a query. He just messaged me that regarding, he wanted me to ask Professor A.K. if there's anything he wishes he did differently in his training, something he had learned differently, and what exactly A.K. mean, Woody means by that, I don't know, but if sir can understand that question and answer it.
Would you change the way that you would have, training in JIPMER, say in the 80s or 90s, maybe it's already changed, we don't know, because we left. So what he wanted to ask was, would you training people any differently today than what you did at that time? Would you want to do it differently?
No, this is capable of being validated. You can ask Shanti. I have told her so many times that I have had such excellent institutes to work with. I wouldn't have done anything differently from what I did. If in the course some people become unhappy and it's okay, that's okay with me. I have never really bothered too much about that, but I don't have any regrets and I wouldn't have done anything different.
Sir, one thing, sir.
Whether you want to change the
method of training.
Was more like, would you want to change?
See, surgery still is a question of apprenticeship. When there are two conflicting requirements. That is, you have to see different people because they may have different ways of managing the same issue. But when you do that, you lose out on the faith that somebody develops in you to allow you to do bigger and bigger things, which will not happen if every 2 or 3 months you go and work in a different unit. So I have always been a votary against too much of intra-unit rotations because it interferes with continuity of training of postgraduates. But that is wrong probably because people start thinking that you have favorites, your own students are your favorites and other unit students are not your favorites, which is not true, because the maximum number of failures in surgery that we have had in the time that I was head of the department has been from Unit 1. And Devashish probably knows that. So these things don't remain in the mind, because people have perceptions which are not true. But you should see many people, but you also should work with one person so you get to know, have some continuity of training.
I would like to say
nowadays
that,
it's not happening.
Yeah, Devashish?
Yeah, I would just like to say two things. I agree with him that every time every senior resident finished his rotation, or for that matter, junior resident finished his PG, they're supposed to go to AK sir's room and tell them feedback about the 3 years of training. What has gone right for them, what has not gone right for them, and how they would like to change those things. And he would patiently listen to each one of us. How much of change was brought in, I don't know, but at least that process itself was very strange. But I've never seen that being followed anywhere else. Everybody had to go to his room and tell him that what he thought was the thing that was right in the department and what was the thing that was not right in his department. Brings me fond memories of him, in his rounds and all those things. And at least when we were there, we never dared to open our mouths in front of him. Just to see him this is really amazing.
Actually, frankly, many of us are scared.
That's another thing that I want
of
to change, The system of education is so restrictive in our country. People are afraid to ask questions. And you never learn unless you start questioning and find out, why are you saying this? And I keep telling them, don't accept what I am telling. Challenge me and ask me why I am doing this and not something else. But somehow that the whole educational system from school has to change for students to become more. You go to some of these foreign universities, it's scary for the teacher. The number of questions he is asked and then the aggressive tone some of the students adopt. We don't have to be like that, but you have to question all the time, then only you will learn.
I'd like to say just one thing. When I just recently joined JIPMER, sorry?
Yeah,
yeah, I had just recently joined JIPMER when, and there was a day where we were doing rounds with S3, that is Professor Jagdish. And as we passed his room, we saw Dr. Ananthakrishnan sitting in his room, and he was at that time the acting medical superintendent of JIPMER. So there was another consultant sitting in his room and used to daily sit for hours together in his room. So that was the issue, and we just crossed it. And Dr. Jagdish told me, you go to his room and call out AK sir, saying that we need a second opinion for a diabetic foot amputation. And at the time, it was a norm that 2 senior consultants had to write that patient needs amputation. So, but I said, but sir, there is no diabetic foot for amputation. What am I telling you? You are the teacher, I am the teacher. Am I the boss or you are the boss? So I quietly went with my tail between my legs, to his room, and he quietly said, sir, Dr. Jagdish is requesting you to come and give a second opinion for an amputation. Okay, in that case, I shall come immediately. So he got up and, came with me. And I was, I had my heart in my mouth. I thought that if he turns around and asks me about this patient, the details and all that, I don't know anything about it. So he went into the ward and immediately he was taken to a side room where everybody is already arranged tea and snacks and other things. So I also did not know this. So I just recently joined. I did not know anything at all. So we all went into the room, and Dr. Ananthakrishnan was given some tea and snacks. And then he slowly asked, "Okay, where is the patient and what about it?" So Dr. Jagdish then told, "Sir, there is no patient. I saw that fellow eating your brains, so I just sent this fellow to call you." My God, I just thought that he would twist my neck there and there. I just thought he was going to twist my neck, and I was just mentally prepared to be sacrificed. Then, he finished his snack and didn't utter a single word. No emotions on his face, and Ananthakrishnan sir got her, and he just patted me on my shoulder and told me, "Nayak, today you have saved my life. I will remember this."
Vidya, we are run out of time.
So I just want to speak first. I remember when I finished the anesthesia, joined a senior resident, we used to have these heavy corrugated hose, and so we used to have an L board which hold the patient's tube doesn't come out. I just incubated and I got asked for it, and you ragged me and he said, "What with you still MD, you still having your L board? Isn't it time to take off your L board?" So I just want to tell you, sir, I have taken off my L board. I don't have it anymore. And thank you so much for being part of my undergraduate and postgraduate learning. Thank you so much for today, because I have never interviewed anybody in my life, and you immediately agreed, and I don't know about the audience. They got bored or whatever, but thank you so much, and it was a real pleasure.
Thank you, Vidya. Thank you, Patta, and all my old friends.
I'd like to thank you also.
On behalf of Learning General Surgery,
Piyush and Chandru and all that. Thank you very much. It's been very enjoyable.
Thanks,
and
sir.
I hope I have passed, Vidya. You have to give me some marks.
No, 101, sir. 101 out of 100, sir.
Vidya, it's pretty sad that legends like Dr. A.K. are not made anymore. For whatever reason, I do not know. It's very unfortunate that the future generations do not have such legends. And I often keep telling my wife, if I have to have surgery, it will be done, should be done by Dr. A.K. and he should live longer than me. Those words, we pray for his health and happiness. And thank you all so much for being here. And it's really, really wonderful talking to you, sir. And with this, I close. Thanks, Vidya. I've done a lot of work behind, and you have to come back with another legend next time. Thanks, everyone.
Thank you, Patta. Thanks a lot.
Thank you, sir.
Goodbye.
Good night.
Goodbye.
Good night.